attending. All right, it's 12:01. Let's get started. Everybody can definitely say hi as we are continuing to do our introductions, but I would like to introduce, we have two great guests today who are speaking on behalf of the Community Murals Project, which I was really excited about. I know we ran an article about it as well. Rick Lupglass, who is the Executive Director of the Laurie M. Tisch Illumination Fund, will be guiding us today and starting us off. And then also we have Ling Dang, who is the Senior Director of Health and Hospitals Arts and Medicine Program. And I had the privilege of previewing this presentation last Friday morning, and it is both inspiring and a lot of fun. So I think everybody is going to enjoy themselves. And Rick, I believe we are going to be starting with a video that the public hasn't seen yet, correct? This is a premiere?
Exactly. So in fact, a couple of people on the insiders group today will have are in it but haven't seen it. It's a video that we had produced based upon the 2019 series, and we were going to release it in 2020, but of course COVID hit. So this is the grand premiere. So let us
Art ignites change. That's what the arts and medicine programs at New York City Health and Hospitals are all about. And that's why we created the Community Murals Project. The Community Mural Project invites everyone in our healthcare system to engage with us by creating a lasting tribute to the unsung heroes of the hospitals and to celebrate our communities. New York City Health and Hospitals is the largest public healthcare system in the United States, serving over 1.4 million patients a year.
This place opens its doors to anybody. It doesn't matter race, gender, immigration status.
They support patients during their most vulnerable times, and they do this every day without much recognition.
You know, you deal with so many different stresses because, you know, you have people's health and lives in your hands. So to take this brief moment just to come and to paint and to know that something that you're contributing to will be a part of the hospital for years and years to come is an amazing thing.
With the support of the Laurie M. Tisch Illumination Fund, in 2019, we launched the Community Murals Project to help address burnout and occupational stress, and to forge new bonds between our hospitals, our patients, and surrounding communities. Hundreds of artists applied. Soon, all 16 health and hospitals and long-term care facilities will have a new mural.
Really great to just see staff members walk by just today in our installation and point out the parts that they painted and take great pride in that.
They said it was so releasing their stress to paint. I use bright colors. Maybe that helps, I hope.
That's how you can do the inside.
Oh, you want to do it yourself?
Okay.
We all know that the arts have the power to heal and to relieve stress. I can't think of a better way to demonstrate that than through this project.
We started with engagement days when staff and visitors met the artists, learned more about the project, and painted their own tote bags. Staff, patients, and community members came together to share ideas for their mural.
The one that you said you liked the most, where it says "Earth, life comes from the sea." So it's like it kind of draws in with the community and what it's surrounded by.
Yeah. And we'll challenge our patients to think about their lives, to think about their hospital.
Just to represent the culture, because we have staff from all over, patients from all over just come here.
Yeah, medicine and love, family.
Yeah. You know, it's really New York City. It's New York City.
It has been an incredible way of finding and learning more about each of you stories.
Artists designed amazing murals and worked alongside our staff and communities.
This really represents what arts and medicine at New York City Health and Hospitals is all about, to come together and reap the benefits of art and the healing powers they could bring.
I think I got the other panel. I'm standing here and I'm relaxing, and I'm actually just doing light brush strokes. It's relaxing, it's healing.
The murals transform our public spaces. They change the perception of our hospital system and environment.
It will be great for your mental health just to not think about what you're feeling at the moment, whether your illness, but to see beauty.
Art touches you in a very deep level. To actually connect with other people, to others.
I actually got inspired a lot by their stories or what they told me or what things they missed the most from home, to bring that as elements inside the design process.
So having something like this gives everyone an opportunity to represent their thoughts, their anxiety, their concerns, their hope, and the vision for the future of the hospital.
Here they were very proud of the babies that are delivered here, so I tried to capture that.
And the thing that I like about murals is the big scale of things, because you can do something really big, you can express yourself really big, and then when you get the community involved, it just reunites people and you can do something all together. It's not just one artist.
So, ladies and gentlemen, I give you a legacy lights the way.
Yay! Each facility has its own voice, its own style, its own theme, its own magic.
But facility artists to bring the staff, the patients, and the people in the community to paint and to come up with a masterpiece is something that I will tell my great-grandchildren about. Thank you.
There you go.
All right. Well, that was that is the second time I've seen it, and it still moves me again to see it, because as Rick, we were speaking about on Friday, that was filmed pre-pandemic, and you see sort of the stress and the burden already on hospitals. This was before they even knew what was going on, before the pandemic, and these guys are heroes, and just to be able to see them work to beautify the hospitals, to bring beauty into the hospitals, I can't think of anything that's more needed right now. And I'm really glad we started with the video too. It's a really great tee up to what you guys are speaking about. And I see even through the chat, everybody saying how wonderful and beautiful it is. And it really is just a great tee up. And I'm so happy to see two of the artists here today. And again, a very well done video. So why don't you take us a little bit deeper into the program? And one of the things, selfishly, because I'm a nerd, I love about this program is the history behind it and some of the spaces that you're dealing with. So go for it. Take it from there.
Absolutely, and this, and we're really glad to be a part of this and appreciate being invited. This really is sort of a two-pronged insider presentation or discussion, because the community murals, which we'll really dive into, are part of a continuum of about 80 years of murals and other art at New York City.
Rick, can I interrupt you just for a sec? Sorry. Could you drop the screen share? Some people are. There you go. That's better. Thank you. That's good.
Okay. Okay, good. The community murals are part of an 80-year trajectory, sort of an arc from the 1930s during the Works Progress administration, when artists were being hired to try to make a living. I think they were paid like $7 a week, so I'm not sure how much they could do with that. But so as a result, there are incredible murals and other artwork around the entire New York City Health and Hospital system. So we'll give you a sort of visual tour of that, as well as diving into this program. We thought that way it would really be of value to both your art fans and your public art fans and your history nerds. And I count myself among all of those categories. So let me bring you back to the slideshow. Okay, Link, so I understand New York City Health and Hospitals is the largest city hospital system in the country. Can you give us a little bit of an overview?
Oh, sorry. Yes, thank you. New York City Health and Hospitals has been around for quite some time, way back in the 19th century. There are 11 acute care hospitals. Acute care is where patients get to live or stay inside the hospital. And then there are 5 long-term care, which are nursing homes. And we have 70 clinics and 6 diagnostic treatment centers. The great thing about New York City Health and Hospitals is that we provide service to everybody and anyone, whether you have insurance or not. So even for like your COVID testing, you could go in there and get tested for free and not have to worry about paying or whether you have insurance or not. But we're here to serve the New Yorkers. That means everybody that's on this call.
That's great. And in all 5 boroughs, I think
yes,
most of the people on today are from New York City, so you're probably not too far. So let's shift into the arts programs. So I understand, and as I mentioned, there's a 80+ year history of the arts at H&H. So why arts in hospitals? Why does it matter?
So I'm sure everybody on this call has gone through what they call flow stage, where you're doing something and then you lose track of time. You're so engrossed in your project or in your instruments or in your art making. This is why art is so important, because it actually helps you to take you from being busy, being stressed out, into your flow state, which is kind of like a meditative state, within 15 minutes. You know, a lot of times monks would go to learn how to meditate and clear their minds, and it would take them years to learn, but art itself helps you to get to that stage within 15 minutes. The reason the arts inside the hospitals is so important for us is because it helps the viewer when they're looking at the art collection itself to transport to a better place, to take a break from their illness or their worries. And the collection itself are placed strategically in order to help alleviate anxiety and to humanize the hospital. But we also offer art programs, and the art programs, that is what part of the Laurie M. Tisch Illumination Fund is very supportive of. We use the arts and medicine program to help our staff to combat like burnout, handle compassion fatigue. With all the news now about all the news about the clinicians. You know, you've heard about doctors committing suicide. Suicide is like the 2nd highest rating for death for clinicians. And so we use the arts to help combat that as well.
I found that one of the most interesting components of this project and getting to know New York City Health and Hospitals is when you talk about arts and hospitals and arts and health, people tend to think about patients and kind of bedside programs and painting, but they don't think as much about the staff and what the power of the arts can be for the staff, as you talked about it, and the work conditions that inevitably, you know, working in a hospital is incredibly stressful. You saw it in the video, the sirens going by. And again, that was all pre-COVID. So we just had no idea what was gonna happen. Ling, do you mind just whizzing through what the Arts and Medicine program is, since there are a number of like maybe 10 or 11 programs to it?
Yeah, so the Arts and Medicine program, it's using art, whether it's visual art collection, art making, music, dance, or literature, to enhance our patient experience and to help with the outcome, as well as the resiliency of our medical professionals, and just to engage our community. It's used to promote health, reduce the experience of pain and or loneliness, to help both patients and staff express their needs and emotions, create a welcoming and uplifting environment. And what I love about arts and medicine is the science behind the art. There's a bunch of research on evidence-based of how beneficial and healing art can be for the participants.
Great. So thank you. That's helpful. So so a number of people have asked, well, why did the Illumination Fund get involved in New York City Health and Hospitals? And I'm glad to see in the participant list that Laurie Tisch herself is on it. So a little bit of background on the Laurie M. Tisch Illumination Fund and sort of what hooked us here. Our mission is what we call access and opportunity to all New Yorkers. That's inherently an equity agenda, and it's looking at disparities across neighborhoods, be it around health, access to healthy food, arts education, economic opportunity. So we really look at kind of neighborhood disparities in quality of life and life issues. So we, about 3 years ago, started something called the Arts in Health Initiative. And it was around how the arts can be used both for healing, but also to address health-related social and public health issues. So the three areas that we decided to hone in on were mental health stigma, trauma, and aging-related diseases. The research showed that those were three areas where the arts could really have an incredible impact. And we looked at it through the lens of disparities, because when you're looking at those issues, there are tremendously different environmental and data differences across neighborhoods because of disparate issues around, for example, forms of trauma. When we were, and we have about 15 grantees, some of whom I see are also on today's Insider Call. When we looked at hospitals and we were thinking about sort of in starting this program, what should we do in hospitals? Because many of the other programs were smaller community-based organizations. And we were finding that there is a trend, more than a trend, a real movement around arts in hospitals. I think as of a study about 10 years ago, 50% of hospitals across the country had arts programs. But what really struck us because of our equity agenda is that the hospitals in New York that had great programs were ones that were what are called private or nonprofit hospitals, university affiliated, and they have endowments and they have boards that can raise funds, and they have galas, they have development offices, and so they can always raise philanthropic money for it. The city hospital, which really represents you and me and everyone else, it's our tax dollars, but they really don't have the means to spend money on art and arts-based programs. So they rely on philanthropy. And we felt like if patients who can afford quality health care through private hospital networks have access to the arts, well, shouldn't we all? Shouldn't everybody? And that was why we decided to partner with New York City Health and Hospitals. We've done a lot of work in the neighborhoods where H&H, we call them H&H facilities are. You'll see some of them. And so our goal then in partnering with H&H was to both take existing programs and amplify them, multiply them, bring them to sites that they hadn't been, because there are many great programs across sites, but this was really to expand and create a broader community. And the piece that we saw missing was this staff piece. As I said, there were lots of programs for patients and for communities, but not for staff. And so our goals in undertaking this were really to build a robust long-term set of programs that would be a resource for staff in dealing with issues of mental health, stress, and ultimately burnout. We know that art alone doesn't solve burnout. There are some many complicated issues, but they're contributing factors that it can really help with, what are sometimes called preventive factors. And so what we did when we started our partnership was we wanted to see, because of the history of the art, new murals in every single New York City hospital and nursing home, and as many of the community health centers as possible. We saw from the research that this would have tremendous value to the patients, the staff, and the community members. So one of the interesting pieces of arts and medicine that Ling mentioned is the art collection. So Ling, maybe if you can talk about what New York City Health and Hospitals owns and how it's used.
Yeah, so we actually have a little over 5,000 pieces of artwork dated back from 1930 during the work in progress, the WPA. And this particular slide actually shows you some of the more prominent pieces we have, such as James Van Der Zee, lots of his black and white photographs, Lee Krasner, Ramir Bearden, Andy Warhol. We have some Rauschenbergs, Jacob Lawrence, Benny Andrews, and some Culvers. You are welcome to come to our hospitals when the pandemic is done and over with to take tours, but we also use the collection to help, I wouldn't say educate, but train some of our clinicians and our frontline staff on how to read people, how to look deeply, and how to be more engaged when they're interacting with our patients and our community. That's one of the programs. It's called the Hearts of Medicine, which is art observation. And we also use these collections for audio art tour, where you could call in anywhere, actually, whether you're at home or in the patient's room. You could call in, and if you have the number for each item, you could learn more about the pieces of art. And this also helps with the patient experience, because sometimes you have long wait time. You could just sit in the waiting area and use your own cell phone to call in and listen to the audio art tour. So we try to use our art to engage the community and to enhance the environment, and just to help people to feel as if they're not really in a hospital, because a lot of times being in a hospital is a scary thing itself. So the artwork helps people to think about other things besides being where they are.
And
so you want to go to the next slide?
Sure. Well, so these are some of the smaller pieces, and there are thousands across the systems, not necessarily as famous as these artists, but I think it's also important to note that there's tremendous number of living artists. H&H has been very supportive of the arts community in New York, and an incredible diversity from in terms of ethnic and socioeconomic. So women artists, African-American, Latino, Latinx, so really an Asian, so really a way to reflect the population, both of the city, but also the diversity of the staff. So those are the smaller pieces. Let's talk about some of the larger pieces.
Yeah, so we have the first one on the upper left, that's a Helen Funkazoller. It's a huge piece. I don't know the specific size, but it's quite large. And that's at NCD, so it's in the Bronx. If you're in the Bronx, that's where you should go and take a look at it. Most of these pieces that you'll see on this slide are in public areas, so you're welcome to visit our site to view these. And then we have the Richard Pousset Dart, that's at Gouverneur. This beautiful glass collection is called Suddenly Laughter by Arlen Wong. And then we have it looks like a mother and child. It's called Learning, William King. It's a piece that we needed conservation, and I hope it's okay for me to share, but Laurie M. Tisch, her mother actually has a piece like this, and she felt attached to it and helped support the conservation for this particular piece, which we're very grateful for. And then we have the Saul Bazelman. This is called March of the Innocents. This is more about like the Holocaust. Sometimes when you go and see a piece of art, it just speaks to you. Well, this one actually grabs you by the heart, and just like being next to it will bring you to tears. This is an amazing piece. And then we have the Milton Sebald, Jake Lubin, and Kenneth Brush, which I believe is your neighbor, right?
Yeah, so
Rick?
Ken lives around the corner on Sackett Street. He has a storefront window facing the street. And I hadn't realized that his work was in the H&H collection. So I saw his name and I saw it on your website and said, oh my God, that's him. So this was a piece he did at Coney Island, I think about 20 or 25 years ago.
Yes, and so we have a lot of big, huge murals. You're welcome to come and visit.
So these are some of the murals, and just for a little context, so you saw in the video Oscar Lett's large-scale mural at Kings County. On the left side of this slide, you'll see some other murals at Kings County. The top one is one of the WPA murals, very well known, and the bottom, for a very different stylistic variation, is the artist Kenny
Scharf.
Sorry?
Scharf.
Yes, sorry, Kenny Scharf. I was drawing a blank, who was commissioned or volunteered his services actually through an organization called RX Art that does a lot of programs in hospitals as well. And on the right, Ling, if you can tell us about the Champagnier Alice in Wonderland series, because these are 3 examples.
Yes, so we actually, this was originally at the old Gouverneur Hospital, and they demolished the building. And so these were saved. They actually had to, drill into the wall and pull these pieces out and made them into kind of framed. And so we have right now we have about 7 pieces, but there are still 11 more that we're doing some conservation for. But if you actually go into Gouverneur, there is one on the upper right-hand corner. This is the one that's in front. It's a mural in front of the library. And we use this also for our art observation, just to kind of, during our new hire orientation, to help our staff notice things, to read body language, to just also help them to communicate better, and to notice that everyone comes from a different background, so everyone has a different perspective. So we use these particular pieces for our art observation. But these are just amazing pieces, and it's actually called Alice of Wonderland and not in Wonderland, because it tells a bunch of different stories. Yeah, but they're great. Like, for some reason, everyone always loved Alice.
These were all from the late 1930s, I believe. Champagnat did the Alice of Wonderland series.
Yeah. Yeah.
And the one at top left is now at Coney Island Hospital. Top right is at Gouverneur, and the bottom one here, the long one, is at Lincoln Hospital in the Bronx. You can also
Rick
see
has
all of these.
a nice photo. You have a nice photo of the new mural and this particular old one next to each other. You'll see that later.
We will see that shortly. Absolutely. So the best known site for large scale murals is Harlem Hospital. They renovated the building and did massive conservation, where they built a new building, and they built this mural pavilion, mostly WPA art, but some since then. And they got capital funds from the city and state to build the new building and to use what's called the light box, basically 400 some odd windows that are an imprint of excerpts from mural. You'll see two excerpts here. The mural was called Pursuit of Happiness by Vertus Hayes, also from the WPA. You can here see the original mural, but it's very cool to see how they incorporated it. So it is now an architectural icon in Harlem. So
can I interrupt for a second, Rick? Your slides, there are two black boxes that are covering the slides. I think you might have, can you move those off the slides?
Did that do it?
Yeah.
Okay.
Yeah, and then there's one up top too. There's one up top. Yeah, that one.
Let me see if I can hide this.
Yeah, I think, hi Rick, I'm back again. I've been looking up the issue. It appears it's actually a Zoom bug, which is going to require a coding. So if you can just move the big box on the side of the screen off, that's fine. And then I think you're probably going to have to leave, you're going to have to leave that long bar where it is. But that should, hopefully that shouldn't obstruct too many of your slides. But yeah, I've been looking it up. It requires coding, so it's nothing we're going to be able to fix now. But I think you're good. I think you're good this way. So
great,
and thank you.
Sure, Ling. Was there anything else you wanted to say about this one?
No. It's pretty amazing. It's it's public view. You can actually, this particular the image, the first and second, they have their own exhibit hall that you can go into. I don't think you need to register or to sign up to visit it. It's just public.
Also, the one on the top right, which was restored a couple of years ago, Georgette Seabrook, she was the first African-American artist to be commissioned by the WPA National Murals Project. She did this one called Recreation in Harlem, and it's many scenes from the streets of Harlem and the homes of Harlem. She also later on became an arts therapist, moved to Washington, and became very prominent in the American Art Therapy Association. So she clearly was inspired in turn.
Sorry, and another interesting fact with that was she was actually only 16 when WPA hired her. And she lied about her age because she thought that they wouldn't give her the job if they knew she was only 16.
So now the insiders here know a secret. I guess she won't get into trouble at this point. So next, I thought we would give you one of the other really interesting sites is Bellevue. Untapped New York has done several articles about Bellevue in the past. I thought I would give you sort of a Zoom rapid tour. We don't have a lot of time, so I thought I would just give you, because I was so blown away when I got to First Avenue. It's around 28th Street is the main entrance. And you see this modern building, you know, which is conventional hospital, modest building. You walk in and you start learning about the history. Bellevue was founded actually in the 1600s, moved uptown, I think in the 1800s during the yellow fever epidemic, and then built what's down here on the left as the what was cutting edge building in 1931, and that was an opportunity because the WPA, where they not only built the building but incorporated the art. You see here, that is that same building. When you come in from First Avenue, this is actually what you're seeing, but it's nested within this amazing atrium. I.M. Pei was one of the architects who I think it was opened in 2005, built this atrium surrounding the new building. So, I mean, the old building, the 1930s building. So it actually provides you a portal into the inpatient area, the outpatient area, the administration. And so when you walk through this hospital and emergency room arch, you start seeing amazing works of art. This is one of the WPA murals, a real sort of pride and joy. It was by artist David Margolis, who was not well known in the 30s, but he was an assistant to, he worked on the Rockefeller Center murals, in fact, I think with Diego Rivera. Diego Rivera loved his work. He painted this set of scenes around the rotunda, which you can still see, and here it is today. All of these pieces have been restored. This rotunda was, for a while, incorporated into the homeless shelter next door, and so the art was covered up. He actually came back in the 1980s to help restore it, thanks to the borough president at the time, Ruth Messenger. And so what you see now is a very restored version. Now, if you walk elsewhere in the building, here up a set of stairs towards the chapel is a Romer Bearden mural called Cityscape, part of a very prominent series. One of the connected pieces is at the Met. It's a collage mural, which was a style he did. He made it in 1973 for Lincoln Hospital in the Bronx, but it was moved to Bellevue shortly thereafter. And coincidentally, Bearden had been a patient at Bellevue in the 1950s. He had a breakdown, was found on the street, brought to Bellevue, stayed there, had a really good experience, and said that that was what inspired him to take up his art again. He had given it up because it was such a hard business. Walk further through the building and you start seeing these amazing sculptures. Lynn, can you explain which ones we're looking at?
Yeah, so the one on the left is actually called the Gorgeous Mosaic, which is perfectly named for it. It was actually donated to Bellevue, and if you look at the piece itself, on the top of the ceiling, it was such a large piece that they had to cut a hole in the ceiling in order to display it. It's one of those pieces where you have to like go up front really close to see all the different individual tiles that were replaced. It's a very beautiful piece. You really have to go further into the hospital in order to see this piece. And then outside, you have the Charles Keck the Larry Moore is the leaping figure that you see on the second one. And then the third one is the Charles Keck, which is it's outside the old hospital. It's in the atrium. The minute you walk into the atrium, it's on the right-hand side. It's called The Family. It's a beautiful sculpture. And then if you go further into the hospital, there's an out back garden area. This is the John Roden piece. And right now, it's one of the other pieces that we need conservation. So we currently don't give tours of this as much, but the audio art tour does talk about each and every one of these pieces. I will put on the chat the number that you could call in, but it's better if you follow the link to our Arts and Medicine page, because then that will give you all the individual numbers for each of the artwork that we have. But these are all,
Sorry.
I'm sorry. Just saying, like they look a lot prettier in person. They're more impressive in person.
That the large piece on the left, gorgeous mosaic, you might know that term. That was David Dinkins' term when he was mayor. He had actually helped with the city support the creation of this mural, and the artist did it in his honor as the gorgeous mosaic. So walk outside into what's called the sculpture garden, and you're going to see one of the murals that was done last year by two of the artists who are in fact on the insider call today, Patricia and Nancy. And it's the sole mural that's a ground mural. So, so the folks at Bellevue wanted to be able to sort of transform the entire space, which had recently been reopened to the staff and public, and really make it welcoming. And there are a number of sculptures within on these circles that were able to be incorporated. So thank you, Nancy and Patricia. So let us move into 2020. Well, I'm sorry. So these were the 2019 murals, just as a recap. And in total, it was what, 7 murals, I believe?
8. Oh, yeah, 7. Correct. Yes, 7.
And I know we do have. I saw a couple of other people in the chat. Let's see. I think Sophia is on, and Priscilla may be on. No, Priscilla from, oh, she's missing, Metropolitan. Yeah, Priscilla, I think, may be on. So 2020 has been a year like no other, as you all know. And the mural was designed in 3 years. The 2000 Mural Project, 2019 was the first year, and we geared up at the end of 2019 to do the next round. We issued, these are all done through an open call for artists. So you'll see the link that if you are an artist, you can apply through that. And the committee went through the rigorous selection process, got about 150 artists applied, and did interviews, just as, and that was in like January and February, as COVID, people were starting to get a little worried. We hoped it would pass. We had, the artists were selected. We had an orientation meeting downtown where they could meet each other and learn more about what they'd be doing. They were paired with the artists, with the hospitals, and then of course COVID. And so H&H put the whole project on pause. This was early March, but they said that when they were so pleased by what happened in 2019, and they saw the time, why it was so timely in terms of issues like burnout, that they said, we want we want this back as soon as we can. So so Ling reactivated it in June with the phase that's the focus group phase, but doing that virtually. Ling, do you want to speak?
Yeah. Yeah. So prior to COVID, we actually met in person, which is always a nice touch, you know, to like meet people, to connect with people. But the honest truth is, because we're in 5 boroughs, it's hard for us to commute from one hospital to the next. It would take us hours, or like it would take us a whole day just to get to one facility to do one focus group. So it wasn't very efficient. So on one hand, because of COVID, it helped us to be more efficient, where during the Zoom virtual focus group, we were able to do maybe 2 focus group in one day rather than just 1 a day. We were able to just get things done a lot quicker and finished the project before the end of the year. We were worried that we wouldn't have enough time, but going virtual actually helped us to get things done quicker and more efficiently. But I think it worked out pretty well. You know, this might be the future for next year, you know, yeah, this year, 2021, keep forgetting. Yeah, so I think it went well. We were able to get 9 out of 10 completed. Our last unveiling is actually tomorrow, because at Seaview, because they had like a surge of patients with COVID, so we had to hold off. But now we're able to finalize our last unveiling and focus on 2021. Yeah. Go ahead.
So let's do a quick visual tour through the 2020 murals. Gotten great feedback from staff. People saying they had worked there 10 years. I met someone at Woodhull who said she'd worked there 30 years. She was out there painting, and she was just never had that experience before, and was just blown away. Really extraordinary. So let's start with the Bronx. And first with Aranza, who is also on the Zoom, and who did an incredible work at Lincoln Hospital.
Yeah, and the great thing about Aranza's piece is
So here are some images of the completed ones. And as you saw in that process with Aranza and the team, all of these murals are not painted on the walls directly. They're done on sheets that are then permanently fixed, and it's called polytab, and then enameled on so that they are permanent works. And yet someday, if that elevator goes, they can peel it off and put it on the next one. So this is one side of the mural and wrapping around the hallways. And here's the other side of the mural on the right here. Up on the top right, you see that is one of the Alice of Wonderland murals that we saw. So you get this incredible juxtaposition of Aranza's mural and the Abram Champagnier. And what's really also exciting about this contrast is all of the new murals are collaborative with staff, and so and really site specific and very inspirational. So while there's a continuum of the murals, you really transform that history in terms of moving from an solely artist-driven to one that is community and staff driven with the artist vision. Jacoby is in the northeastern Bronx. Just show you very quickly. There you go. Queens, there were 2 new murals this year. One at what's called Queens Hospital, which is out in Jamaica. And I saw Danielle is on the insider list today. So here is the finished product, all the way down a hallway. You can see it from outside as you drive up. So it really is sort of an iconic visual element. And there's the ribbon cutting. That's okay, we don't need the video.
1, 2, 3.
And right around the corner in the same building is one of the WPA murals. This is by WPA muralist William Palmer, and it's called The Functions of the Hospital. He built it, he did it in the late 30s or early 40s at Queens Hospital. It was restored and brought back to this location. He did another mural at Elmhurst, we'll see in a sec. So Elmhurst Hospital, we know, is the epicenter of the epicenter of the epicenter. They were so thrilled to have an opportunity to participate in a project like this when things calmed down. Fernando Lechon is an artist from Ecuador who lives in Astoria. And here is his mural. There's Fernando on the right. And there's the completed mural. He talks about that it went from the dark days of COVID to community support, staff support, reflecting the cultures of Queens with Chinese immigrants, Indian immigrants, Middle Eastern, and many South American, Central American, including his own very large Ecuadorian community in Queens. And this is the other William Palmer piece, which looks at the history of medicine from the plague all the way up to preventive care in the, I'd say more modern, but again, it's more modern as of the 1930s. Brooklyn, we did one this year at Woodhull Hospital. Amani Shanklin Roberts, an amazing Brooklyn-based artist. Paint Day, this woman here is the one who worked there for 30 years. This is the completed mural, Woodhull Heals. Ribbon cutting. This young girl here is Imani's daughter, who was then incorporated into the mural. Really cool. And then walk into the building, and this is where you'll see the Keith Haring murals. There's a very large one in the lobby that really is iconic. People, it's featured on the Untapped website. And then around a little further into the building is a black and white detailed mural running along the top, along the hallway. So, and Haring donated his services to this because he was so appreciative of the role that Woodhull played with friends of his who had HIV, AIDS, and who unfortunately died there. And in the late 1880s, he wanted to donate a mural. So this is it. Moving to Manhattan this year, we had 2 sites. One was at Gouverneur, which Ling mentioned, and this is at the new building at Gouverneur. Ellie Bulk, a Brooklyn-based artist, was the artist. She walked all through the Lower East Side to come up with sort of a color story or a palette, and then interviewed all of and got data from all of the staff and the residents, what floor they lived on, when they were born, how old they were, what their horoscope is. And each of these represents a resident living in the long-term care facility. So really just an extraordinary work. You can see it in the process of being prepared, and then it wraps all the way around by the parking lot and into a public garden. Judson is the second Manhattan site. Amanda is currently one of the city's artists in residence working with the Division of Human Rights, and has a new mural at the Barclays Center on anti-Asian violence. The Judson is a community health center, and it specializes, they're the first with what's called Pride Center. They specialize with LGBTQ patients. And so when the staff and patients got together to talk about a mural, they wanted something that really reflected gender diversity. And so that was the nature of the mural, to give a much broader and more welcoming experience. And for staff there who've dedicated their lives to the work and take so much pride in working in a Pride Center. Finally, Staten Island. This is the one that Ling and I and Laurie are ribbon cutting tomorrow. It's at this site called Seaview. The artist I think might be on today, Yana Dimitrova. She is from Bulgaria, but of course now a New Yorker. All of the artists are New Yorkers. That's part of the intent. And she took inspiration from the history of this place called Seaview, which went back. There was originally sort of a poorhouse farm colony where instead of being on welfare, people lived there and did and produced. They had a garden, they produced furniture, and then it became a very famous TB sanatorium, and was the site that one of the cures for TB was invented by a doctor at Seaview. Now, throughout the campus are buildings that are currently in ruin, but had these incredible architectural details. So the artist took, these are two murals from the WPA that were done at the farm colony. You can see them on the back wall. And she took murals that were in different sites, incorporated them. And this is an architectural detail that she incorporated from a subterranean tunnel that in fact you can also see written about on the Untapped New York website. Here is the mural being done. And this woman, I'll talk about in a second, her name is Virginia Allen. She is the last of what are called the Black Angels, and they were African-American nurses who were recruited during the height of the TB epidemic because a lot of white nurses didn't want to work in more diverse environments. Obviously a time of tremendous racism, and the medical community was unfortunately no different. So the city went out and recruited nurses from around the country. Virginia was one. She is the sole living one. Oprah Winfrey will be publishing a book. There's a documentary that includes her. She painted part of her own face. Here on the right, is herself, and Yana helped her paint herself into the mural. You'll also see the aesthetic is very much tied to the visual icons that you saw a second ago. And there she is again. She will be at this ribbon cutting tomorrow, so really, really cool. And that is the extent. Just to leave you with the 2021 mural before going into the Q&A for you, is we just opened a couple weeks ago the new open call for artists. It's on the website of Residency Unlimited, which is a wonderful nonprofit in New York City that's been partnering to help do to reach out to artists and do the selection process. There will be a link, I think, either in the chat or certainly on the website, so that you can spread the word about this. The deadline is at the end of this month. Artists will be chosen in February by an independent committee. And then the next wave will be focus groups and paint parties and engagement days. And it's 9 or 10 new murals. In this case, it will include Harlem Hospital, but also many of those smaller community health centers that you saw on the map in several boroughs. Ling, is there anything you want to close before we go to the Q&A?
Not really. I wanted to thank Untapped New York for inviting us, and also I'm also always extremely grateful for the Laurie M. Tisch Illumination for supporting us financially, emotionally, just everything. I feel like you're our angel. Anytime we need anything, you're able to be there for us. Even like just time, advice, everything. So I just want to say thank you for that. And then also thank you, the participants who were able to log on. Thank you for your time. And I hope that this was helpful for you.
Thank you.
And
go ahead, Rick. Go ahead.
Oh, if any of the people watching are feeling very generous, all of this is supported through philanthropy. You know, H&H's mission is to take care of New York. So they rely on foundations, individual donors to support the art conservation and other components. Right now it's art conservation because these are works that are amazing, but have lived a long life in public hospitals, and it's not a museum, it's not climate controlled. So I'll give that shameless plug so you don't have to.
Great, and thank you both very much for such an inspiring project. The comments that have been coming through have been just wonderfully positive, and I agree. Thank you to all of the artists who came today to this talk as well. So great to see you not only represented by your work, but also here. And I have put links both to the open call and to the Community Murals Project for people to learn more. And we do have some questions. So I am going to start first with the Q&A. We've got one question in Q&A, and then I'll take it back to the chat. So the first question comes in from Zara. Hello, how do you choose which hospitals to include each year? And how do you pair the right artists with the hospitals for the greatest impact? That's a great question.
Yeah, so how do we choose the artists?
First, it's how do you choose the hospital, and then the right artist with the hospital.
Okay, so the truth is, the way that we initially offered the community mural to the acute care hospitals, because we have 11 of those, and we just sent out a blast email to all the CEOs and asked which ones were willing to or wanted to participate, and so that's how we chose. They really chose us per se, and then after the interviewing, the process is we give the CEO all of the artists and allow them to select their top 3 that they wanted, and then we match them up according to that. So it's a whole process. Yeah.
So the hospital then is the one who picks.
Right, because usually the CEO.
Yeah.
Mm-hmm.
So the committee shortens that to 150 down to about 10, distributes them out to those selected CEOs who have opted in, and they choose from among those a set and hopefully get the ones that they prefer. A little kind of historical nugget there is why it's so important for the CEO to be involved and bought in is one of the murals at Kings County in the 40s was commissioned and the CEO did renderings and didn't. It's not that he didn't like it aesthetically, he didn't like the themes, and he shut it down. That mural was never executed, but the drawings from it are now in the collection of the Brooklyn Museum.
Oh, neat. Cool. Great. So I'm going to go back to the top of the chat and just go through the questions and share some highlighted comments. The first question that came up when we started was, will the video be online? So I believe it's the video that you premiered. Will people be able to see this video?
Yeah, we'll make it available. We'll put a link, probably both on, I would imagine, laying on your website, but also on the Illumination Fund's website, which again, to be up to the moment, we are launching our new website the day after tomorrow.
Oh, wow. You got you have a busy day tomorrow, huh? Ribbon cutting a new website. Well, good luck with both. Robin Glazer said the controversy around the bearded mural at Lincoln Hospital is so interesting. It was removed because of the nude woman in one of the windows and became a cause célèbre of the council person, I believe. Thank goodness it wasn't destroyed. It's an interesting tidbit.
It is. So there was a committee, folks from the Studio Museum in Harlem, et cetera, who selected the artist and the work. It was for Lincoln Hospital in the South Bronx, heavily Latino and African-American population. One of the Latino city council people, and this was the early 70s, felt like it should not just reflect the African-American community, but needed to reflect the Latino community, and he wanted it out. So it wasn't just the nude woman, but there was a racial dynamic there as well.
Got it. Carol asked, curious to know who was involved in the focus groups.
So we also allow the hospitals to have control with that. They invited their staff members, some of the patients, their community members, the CAB, just and leaders.
Community advisory board. Every hospital has a community advisory board.
Yeah. So yeah. So we work with the public affairs person there and also the CEO, and they give us a name of all the people they wanted to invite, and we just send out the email, and whoever shows up for the meeting shows up.
Great, got it. We had a question, is the open call restricted to New York-based artists?
It is a high preference. The way it's articulated is that artists have to have a strong connection to New York. But I think everyone's chosen ultimately just because there were so many choices were New York artists. And in some ways, I think the imperative now, given the economic challenges, is that we love to see New York-based artists supported. It's like the WPA. So it's not a requirement, but it is a very, very, very strong leaning.
Got it. Really, really great comments. I'm not going to read all of them, so everybody on the chat, please look at the chat. Very inspiring feedback. I do love, Sophia said, it's so nice to see Ling and Rick. This project helps us, artists, and hospital communities a lot. And that is very obvious as somebody who has just lightly dipped his toe in this. It's just, it puts a big smile on your face and a warm feeling in your heart, especially, again, knowing what we are going through and hospital staff and patients are going through as well. Art is so healing. As a writer, I know what it was to heal through art. So we're getting thanks to Miss Laurie Tisch, and then Laurie also added a comment. She said, adding my thanks to Ling et al. For the work that you have done to make this project so gratifying, successful, and illuminating. Thanks as always to Rick for quarterbacking this unique and important program. I love quarterback. That's a great way to put it.
Well, you know, Laurie's family are co-owners of the New York Giants, so of course, you know, we have to get the metaphors in there.
There you go. Well, we are a Giants family, Laurie, so my dad's going to be thrilled. Thank you for joining us today. We're honored to have you. Also, Irene asked, but I don't think she got the question out. I have a question. I'm an artist applying for a mural for one of the health facilities. So Irene, if you have a question, please put it in the chat. Christina said, watching from Canada, thanks for this. Impressive how many considerations go into the work. Also impressive how much calmer I feel just having viewed the pieces. I agree, Christina. I felt calm just watching the staff members paint it. I was like, oh, this is great, even by proxy. Thank you for the info. Love the reference to the WPA programs. Feels relevant more now than ever. That's true. Sending gratitude from Kings County for the gorgeous mural.
And that's Carlos, who is the head of art therapy at Kings County and a real advocate of the arts. And you would have seen him in that photo of the ribbon cutting.
Oh,
really
nice.
Terrific programs, one of many arts programs at Kings County Hospital.
And Arantha, I hope I said that right. This project changed my life, and I am happy I can help improve the lives of others. Also, thanks to H&H and the Illumination Fund. Really, no words. And Patricia says it very well. I'm so touched by the presentation. Nancy and I are very honored and grateful to be part of the arts and medicine. This is Laurie, my eternal thank you for everything. Rick and Ling, you are stars. We miss you all very much. Sending love. Oh, okay. Irene put the question, and I think we'll wrap up with this one on the Q&A list. Thank you all for your wonderful work. I have a formal question about the artwork I plan to submit. Does the work need to be flat or can it be textured? Ah, there we go. That's a great in the weeds question.
Ling?
So due to the fact that we're in a hospital setting, there are certain rules and requirements for fire hazard, infection control. Right now, we can only have a flat mural. If it's textured, it's just harder to clean. Viruses, bugs, bacteria could like grow inside the textures. So yeah, it has to be flat, unfortunately.
Got it. And I will wrap up with this comment from Robin, such a wonderful program. Thrilled that the WPA projects were restored. Love the mix of the old and the new. I agree completely. This presentation was great all around. Not only did it appeal to our insider sense of loving to uncover some of the great history that's being preserved in New York, but also something that's great for the future of New York as well. Thank you very much, Rick and Ling, for all that you are doing. Thank you to all the artists who joined us today. And please follow the links for more information. This recording of this talk will be made available to our insiders on our archive, which our insiders know well. Rick and Ling, I will send you a link of the recording as well if you would like to use it for your purposes. And I hope to have you guys back. Let's do a 2021 update and a look to 2022 next year. I think it would be great. Thank you, Patricia. Thank you to everybody who joined us today. Any final words before I end the meeting? No?
I appreciate your giving us this opportunity to talk about it. And thank you. And congrats on the Insiders program and Untapped New York.
Oh, thank you very much. Our insiders are the best. And
yes.
And we thank you for presenting to us. And as Patricia said, NYC rocks. Have a very good afternoon, everybody. Stay well and be safe. Thank you.